Hello, thank you for joining us for tonight's educational webinar on uses of therapeutic Botox. Tonight's speaker is Dr. Martin Taylor, OrthoNeuro neurologist. Dr. Taylor is a board-certified neurologist specializing in diagnosis and treatment of head, neck, and neuropathic pain, movement disorders, and botulinum toxin therapy. Dr. Taylor will answer questions following his presentation. Please type your questions in the Q&A box at the bottom of your screen. Dr. Taylor?
Thanks, Heather. Thank you for attending the seminar. I'm going to kind of bring up my slides and start talking. And again, like Heather mentioned, please don't hesitate to ask questions. This talk is going to be talking about botulinum toxin therapy, and I'll talk about what that means. I'm going to share my screen here. And we're going to be talking specifically about therapeutic uses, meaning medical uses, not necessarily cosmetic, although I'd be glad to discuss questions as we need to. Heather, can you see my slides there?
Yes.
Okay. So this talks about botulinum toxin therapy, but the term that you're probably used to is Botox. So let me break that down. So Botox is a form of botulinum toxin, and it's the most common one used in America. There are other medications that are very similar that you may or may not have heard of, because some of them are used in and for cosmetic use. That's Dysport, Mileblock, and Zeman. And then there's a couple of other ones like Daxxify, which is a brand new one, and a couple of other ones we're doing research on, including what we're doing in our clinical trials at our clinic right now. So I'll focus on Botox because it has the most uses and people are aware of what we use it for. But there are other toxins that may have similar effects, and some of these cross paths as far as which drugs are used and which are approved by the FDA. What I mean by that is which drugs are actually allowed to be used for a certain diagnosis that's on label, as opposed to off label, a drug that's not allowed by the FDA but still used in the clinic. So in my practice, I've actually been injecting Botox for about 25 years. I was lucky enough to learn during my residency at the University of Rochester in upstate New York. And this was really starting in the late 90s, when we didn't have a lot of official uses for the drug. And I'll go over kind of the timeline. And I was involved in a lot of trials initially in some of the approval for the drugs, but we've been using the drug previously for non-FDA approved uses because we knew that the drug worked, it was safe, and then led to all these other new uses, which are extremely exciting. Okay, so it's probably the biggest part of my practice, and I teach physicians locally as well as over the country how to use this drug correctly. So we'll talk about what is botulinum toxin therapy, what actually is botulinum toxin, how does it work, what are the traditional indications, and what are the emerging indications. And I'll sort of say, okay, this is a traditional indication that's approved by the FDA, or one that may not be. That's a nuance for patients, because you may come in the clinic and it may not be appropriate, but it is important for coverage for insurance also. So it's really fascinating. So the actual molecule for Botox is essentially a protein that is purified from the toxin made from a bacteria, Clostridium botulinum, which is what causes botulism. So this bacteria is present in the soil everywhere. And as you know, you hear stories of bad meat or bad canned products that may produce botulism or botulism type effects. And what happens is this toxin obviously is very, very potent. It can kill people. But there are 7 specific proteins that are made within the toxin. And Botox, or the other drugs like it, are a purified toxin that is very specific, that does one action. And I'll talk about that in a second. So there's no chance of infection. It's not a bacteria, but it's actually a toxin. Now, every drug is a toxin. If you use a little bit, it may not be effective. Certain drugs that have a certain action will cause improvement in a condition. And if you use too much, it's toxic. So it's no different than any other medication in that sense. So it was really in the 17 to 1800s that we really knew about this bacteria. It took until the 40s that the drug itself, or the protein, was actually purified. And then Alan Scott, an ophthalmologist, started using this to treat strabismus, which is lazy eye. And he wanted a medication that would temporarily weaken the eye muscle. And basically, so if you've got strabismus or lazy eye, one eye may go out this way. Well, the eye muscles are basically yoked by muscles on either side and around the eye. And if, let's say this muscle, I'm not sure if you can see me in the screen, but if this muscle on the one side is too tight and this one's weak, you may want to basically weaken this one so the eye can straighten up. And it was actually called oculinum first and later coined Botox. So the first indication and the actual approval was in 1989, and that's when the drug was known as Botox. And in 1997, a new formula came out, which really led to the less likely to be any kind of long-term problems with Botox. So what's the action? So this is a little bit difficult to conceptualize, but I'm going to go over as best I can. It basically prevents a chemical going from the nerve that causes contraction of the muscle. It prevents that chemical from going to the muscle and causing contraction. And that effect lasts about 3 or 4 months. So it's a temporary effect. It does not damage the muscle. This also affects secretory glands like salivary glands and sweat glands. And there's no significant damage to the muscle or the other tissue, but it is temporary, which is obviously good and bad. This is just a little cartoon. I don't want to belabor this too much, but basically just going over the round bottom area is the nerve and the pink area is the muscle. And this cartoon just shows how the drug actually prevents this chemical from going to one place to the other, preventing contraction. Now, a little reduction in this contraction can reduce spasm and tightness, and too much of the drug can cause weakness, which we don't want to do. There are several different specific ones and different actions. This slide's for medical evaluation and basically lecture, but not for laymen. So I'm not going to go over that in detail. I'm going to actually pass a few. So at this junction, there are other chemicals that can be involved, and I don't want to go in detail, but this one chemical is called acetylcholine, and that drug or that chemical is involved in contraction of the muscle, but there are other ones that are involved in pain and secretion. So we think the drug has an anti-pain effect. So what does it do when it affects the muscle? So we injected the muscle. There's no other way right now to get it in the muscle, the tissue. It decreases spasm or tremor, jerking. It can improve the ability to ambulate or transfer. So that means walk or transfer. If, let's say, you have tightness in your muscles, have you seen somebody who's got cerebral palsy or someplace like that, or a stroke? They can actually get up from the chair, going to the bed. It can delay or prevent contractures, and that is specifically related to patients who've had a stroke. And as their muscles tighten, they get tighter and tighter and tighter to the point they can't move their muscles, and their tendons actually shorten to the point where they can't move their limbs, and that can prevent those contractures. It can decrease pain, and that's the biggest thing that we do right now in my practice is reduce pain through decreased spasms. It can improve hygiene, and that's in patients who have excessive sweating, patients who have problems with getting into the groin area that might have tightness and can't even open their legs up after a stroke or with cerebral palsy. And of course, it can increase body or improve body image, which we're not going to talk about in detail. So what are the side effects? Now, there's a lot of things in the internet, and again, I've been injecting this drug for 25 years, and I've seen some minor side effects. There are a lot of things in the package insert that this drug mentions. And there's something called a black box warning where the FDA talks about a possible spread of effect where it can cause generalized fatigue and even problems breathing. Now, that is such a rare instance, and I've actually not seen it myself at all in 25 years for thousands and thousands of patients, but it is in the package insert. What I see is minor discomfort from the injections. The needles are relatively small. You can have some bleeding, which is called the hematoma, which with any injection. The package also mentions a flu-like symptoms like an achiness or soreness, which can occur in their whole body. I rarely see that, but can see it at times, and it's very, very self-limited. And then again, this overall weakness if patients have this systemic effect, which is extremely, extremely unlikely. There's something called antibody production, and that's where your body produces antibodies. You know about antibodies because of COVID now, and understand how that works in a sense. Basically, when your body is exposed to a certain substance that's not your own, the body can attack it. Now, that is highly likely to cause a problem with this drug or any of the Botox type cousins. But if your body was to make antibodies, it would basically decrease the effectiveness, and we typically don't see that. You can typically or can have dry mouth, specifically with Mileblock, which is a cousin. But essentially, I see achiness or soreness and some minor weakness in some patients. Now, I'm not sure if you can actually see this whole cartoon, but it says this is going to hurt much more than 100 small ones, but it's much faster. Obviously, our needles from the Botox clinic are not that large. It's, by the way, it's hard to be funny and not have a little back and forth with the audience as I'm talking to a computer. So I want to talk about traditional indications, FDA and FDA indications. And this is really just the idea we're going to go over, and then I will leave it up to questions. So the first indication in 1989 was strabismus. That's a fancy word for lazy eye, and we still use it for that. There's also, at the same time in 89, there is a condition called blepharospasm, which is twitching of the eyelids uncontrollably. There's two reasons for the twitching of the eyelids. One is tics in kids. That's not what we're talking about. This is adults, typically between the ages of 40 and 60, that have spontaneous twitching in the eyes. We inject around the eyes itself and can reduce spasms and get an incredible relief for patients for 3 months. There's also something called hemifacial spasm. So instead of both eyes twitching, it's one half of the face that twitches. And that is caused by a problem with one of the nerves called the facial nerve, and we can reduce that. Now, one of the most common things that I treat in my clinic, it's a rare disease, but we see it daily at our clinic, is something called cervical dystonia. Cervical means neck. Dystonia means twisting or turning. The old term, this is torticollis. This causes a pulling and twisting of the patient's head. It can be turning or twisting or side bending, a lot of pain for a lot of patients, and actually commonly a tremor or jerking. And this drug was approved in 2000 for that. Hyperhidrosis is excessive sweating, and it's officially approved for excessive sweating in the armpits, but we also maze it in the hands or feet, not as common. And I think that was approved in 2006, I'm not sure. There's something called focal dystonia, which is also known as writer's cramp, which is less common form of dystonia. As I mentioned a second ago, dystonia is a twisting or turning motion. Writer's cramp is the layman's term. Basically, it's not just, oh, my hand gets a little crampy when I write. It's actually, I do a task like using a screwdriver or doing some other fine motion, and my fingers can turn or twist, or my wrist can twist to the point where you can't even use your limb. That's not approved by the FDA, but we inject for that on a regular basis. There's something called spasmodic dysphonia. So spasmodic means spasms. Obviously, dysphonia affects the vocal cords, and the vocal cords can actually spasm, and you may get abnormal voice, including a tremor in your voice or a breathy voice or difficulty producing words, and that can be used significantly where an ENT physician specifically takes a specialized scope and goes down into the vocal cords. That one is used on a regular basis, but is not approved by the FDA. Spasticity was approved by the FDA in 2010, and spasticity is increased tightness in a muscle, typically associated with an insult in the brain or spinal cord. So that would be a stroke, traumatic brain injury, spinal cord injury, or cerebral palsy. So, and I'll talk about that in a second. And of course, cosmetic use. Now, first it was for, what are these called? These are 11s or glabellar lines, and then frontal lines, and then crow's feet. And again, some of the other drugs like Dysport and Myblock Dysport and Xeomin are approved for cosmetic use also. So torticollis is the previous term, and I mentioned twisting or turning, and this is basically cervical dystonia. Torticollis just means turning. And this is a patient, the male on the one side, he has twisting and pulling the head backwards. And then this is a less common form of really what we call wry neck is the old term also in a child, which we see much less likely. And these are just the various postures that patients can have. And sometimes it's not obvious because some patients may not have such torsion or twisting that diagnosis is clear. Sometimes it's very subtle and why they get delayed diagnosis before they get Botox. Now, this Botox and drugs like it, the cousins to it, are the drugs of choice for that condition. There's also something called oral mandibular dystonia. Now, this can include twisting and turning of the mouth muscles. Some of these can be associated with other medications, specifically antipsychotic medications. If that's the case, Botox doesn't work very well. The more common medications, the condition it works for is clenching, which is called bruxism. So people clench, they can have pain in the area, they can have tightness and pain in the masseter muscles as well as the temporalis muscles. I mentioned writer's cramp a second ago. This is just showing actually an unusual motion of this patient's thumb coming back when he's actually writing. This is called hemidystonia. So patients will have writer's cramp in one arm, but patients can have dystonia, twisting and turning on half their body. And we see that typically more commonly with cerebral palsy. This is a picture of a patient with blepharospasm. And this is so severe in this case, the patient cannot actually open their eyes because their lids are clenching so tightly. This is a pretty severe case. And this can actually lead to functional blinding, so patients can't even see. This just gives a picture of the vocal cords. I'm just going to skip this real quick. So what are the challenges of patients that have dystonia specifically? So this is this twisting and turning motion. So these patients get misdiagnosed. They typically see multiple they've seen multiple physicians get misdiagnosed, or their doctor just says, I don't know. Their family doesn't understand them. They may have a twisting or turning or jerking, and people just don't understand why that motion is occurring. And they say, well, why can't you control that? And there's no controlling the motions. The treatments in general are symptomatic. In other words, there's not great treatments medication-wise. Patients have a great ability to cope, and they may have other problems with what are called movement disorders. So, for instance, patients with Parkinson's disease are more likely to get the blepharospasm or the twisting of the neck. And medications cause significant side effects, which is why we've used Botox. This is just a doctor that says, I'm putting on 2 earrings. So this is a great display of what we see with dystonia. And a patient may come in and they have a twisting and a turning just like this. And obviously in this case, the patient has a very heavy earring, but it just displays the problem that you can see with a misdiagnosis in a sense. I'm going to go, I mentioned pathology of spasticity, and I just want to reiterate this again. This would be reasons for tightness in an arm or a leg, as stroke, MS, cerebral palsy, traumatic brain injury, or encephalitis, infection of the brain. Skip a couple of things here. These are just pictures of different kinds of spasticity in children. This is post-stroke spasticity, where patients will have tightness in their hand, or they have tightness in their wrist, or they can't extend their elbow. This says you're messing around with something off-label. Obviously, this gentleman is growing something out of his head. And we don't take lightly the use of medications off-label as what it means by not approved by the FDA. So there are certain drugs that we have out in the market that we use. We know the side effect profile and the effect, and we may use them in a different condition that we have experience with, but that specific condition is not approved by the FDA, but the drug itself is. So what are some newer indications? Well, I mentioned excessive sweating. That was, I believe, in 2006. The exciting ones that you probably know about, actually the biggest one is chronic migraine. So that's headaches. And I'll go over that in detail if anybody has questions of what patients have to be criteria for that. And then bladder spasms. So the most common reason for patients to have urinary frequency or accidents is typically excessive spasms of their bladder. And so urologists do this, I don't, but they actually go in with a scope and actually pepper the bladder with medication, relax the bladder so it's not spasming excessively. Some other things. So tremor is really interesting, and this is specifically hereditary tremor. And we're doing a clinical trial right now sponsored by the maker of Botox for tremor. Now, this is a problem where the typical diagnosis is both arms, but usually it's the dominant arm that's worse. And when a patient holding an object or pouring something, then they'll have a tremor. And it may be very debilitating, and it gets worse and worse as they're holding something. And so we're recruiting patients for that study right now. So bruxism, as I mentioned before briefly, is tightness of the muscles. That is not FDA approved, but it's clinically appropriate. We use that on a regular basis. And that spasm of the muscle is not a problem with the joints. So muscle pain, fibromyalgia type pain, low back pain, any kind of muscle spasms this drug may have an indication for, but a lot of insurances may not pay for it, so it may or may not be appropriate. It's not first line for any kind of neck or back pain, but if you have spasms and you've been through some other treatments that have not worked, even if they've had surgery or not, you could be a candidate. There's something called piriformis syndrome, which is a tightness in the buttocks muscle that works very well with. And then there are other inflammatory or tightness problems with the tendon, for instance, tendonitis, such as there are 2 major types of tendonitis in the forearm, and that is tennis elbow and golfer's elbow. So tennis elbow and then golfer's elbow. So this drug relaxes the tissue and can reduce pain. And as an option besides having surgical intervention for really severe tennis elbow, Botox can be used, or botulinum toxin therapy can be used. There are some studies using it in joint pain, but they're really not positive right now. We don't use it on a regular basis, but that could be something in the future. So it's really exciting, the use of this drug. It's not a cure-all, but there are specific indications, typically muscle spasms that cause pain, twitching, tremor, or abdominal movements. We mentioned excessive problems with sweating. I didn't mention I mentioned it briefly, excessive salivation, typically related to multiple sclerosis or strokes, and also Parkinson's disease. And there are actually two sets of glands, the parotid glands and the submandibular glands, that cause you to salivate in general, but you can have excessive salivation, which can be a major problem, and it can dry those glands up, and does a really great job. So that is the kind of a nutshell what botulinum toxin therapy and specifically Botox are. I'm going to stop sharing my screen, which I think I did already. Let's see here.
Yes, you did.
And I'm going to leave it open for questions.
Okay. The first question is, how long will Botox last?
So it's very consistent. It lasts 3 months for almost all conditions, with the exception of bladder. It can last 6 to 9 months in certain patients. And also in sweating, it may last a little longer. And so we see patients every 3 months, so we don't wait for it to wear off. I'm going to preempt one person's question about effect. I have patients that have been getting it for 20 years. It does not lose its effectiveness. You don't have to increase the dose, and patients do not build up tolerance to the drug over time.
Does it work on all migraines?
It does not work on all migraines. It does not work on all patients. So you have to meet criteria for what are called chronic migraines. So that's defined by 15 or more headaches per month. And they have to be migraines in the original, and there are other reasons for headaches besides migraines. Patients have to have failed 2 typical preventive medications by mouth. And if they meet that criteria, they may be a candidate for Botox therapy. Now, if a patient's been through multiple treatments and they have frequent headaches, they may be a good candidate and they're likely to do well. I'll mention also that there are other products coming online, including Dysport, which is cosmetically. We're doing a study for that in the summer, in a couple of months. We're looking for new patients for that. And we're doing another trial with a drug that's actually from Asia. That's a new drug, a new toxin that'll be in the market soon. We're actually recruiting for patients for that trial also.
Botox can only be used for pain caused by muscle spasm, not for agitated nerves. Is that correct? As examples, it could be used for occipital neuralgia instead of a nerve block, and not used for sciatic pain in place of epidural injections.
Okay, so somebody's asking very specific parts or questions about conditions. So sciatica is is inflammation of the sciatic nerve as it comes through the back, through the buttocks, and down the leg. The piriformis muscle is a muscle that actually layers over the sciatic nerve, and if you have sciatica pain down your leg, because of the piriformis muscle and it's pushing on the sciatic nerve, it can help. So it's a secondary improvement. If you have irritation of the nerve root in the back, you need an epidural or you need surgery or some other treatment. Botox will not work. In the back of the head, somebody mentioned occipital neuralgia. This is the occiput. Neuralgia means irritated nerve, and Botox can help reduce the spasm on the muscle, which can help calm the nerve down. And there may be some secondary nerve effect. We don't know as much about that. So it doesn't affect the chemicals in the nerves that involve pain, but the major effect is the muscle.
Do I need to take medications as well when on Botox?
So it depends on the condition. So a lot of our patients just get Botox. For instance, if you have migraines, if you're still going to get migraines, it does not eliminate them. So if you get a bad headache, you have to take your medicine. The intention is to reduce your headache frequency and intensity by 50 to 75%. And the patient that has cervical dystonia or writer's cramp or blepharospasm, no medications are needed because Botox really is the treatment of choice, and medications don't tend to do well.
How common is wry neck, and why is it misdiagnosed so often?
So wry neck is uncommon. It's very common in my practice, but it is misdiagnosed because really lack of education from the general population and physicians. And if a patient comes in and they're twisted and turned like this, sometimes the physician will look at the patient and say, well, I know something's wrong, but I'm not sure what it is because they haven't been exposed to the diagnosis. And then we use the term cervical dystonia now. Some patients are just very subtle and they're just have a little tilting or twisting, but they describe pain in muscles such as these are called the sternocleidomastoids, which are atypical for neck pain. They may even have surgery, but somebody doesn't catch the fact that they're having muscle tightness. The spasm is the major problem. Sometimes patients have a tremor and the physician may think it's hereditary tremor and not from what's called a dystonia. So, as physicians, we see what we see, we know what we know, and there are things as a neurologist I don't see orthopedically. I may miss something from that perspective. And there are doctors that just don't see this, and it's not a common disease. But anybody who has neck pain could have dystonia. The likelihood is low, but it's still possible, especially if they have pulling, twisting, or a sense that they want to move their head or their head wants to pull in a certain direction. A description of tightness or pulling or any kind of tremor with your head, with your neck problem, suggests it could be cervical dystonia or the old term right neck.
Can Botox be used in children?
It is approved by the FDA for children specifically for spasticity, which is tightness of the muscles related to cerebral palsy. And at children's, it's used extremely commonly.
Are there certain medications that you use with Botox and migraines?
So that's sort of another lecture by itself, but I'll mention in general, before we get to Botox, there are 4 classes of medications that we typically use as prevention of migraines. We're not talking about treating with a migraine when you get one. So I take a pill, my headache gets better in an hour or 2. So these are blood pressure medicines, most commonly what's called a beta blocker, anti-seizure medications, antidepressants, and there's some other injectables called CGRP inhibitors. So those are the mainstay of prevention. And again, it's a different lecture on how these things work. But Botox can be used if a patient has failed and they have enough frequency of headaches. Again, we don't use it for patients who have 5 headaches a month. It's not appropriate in that situation. They have a lot more, greater than 15 days per month.
Will my wrinkles decrease with Botox migraine treatments?
Yes. So obviously that's not the goal, but part of where we inject for migraine is cosmetic. It's essentially the same injection. So basically for migraine, we inject this area, which is your 11s or glabellar lines, frontal area. We inject the temple, the back of the head, the neck, and the shoulders. So these injections here and the ones in the frontal area are pretty much exactly cosmetic effects. So you will get a cosmetic effect. You want to get to a neurologist or a practitioner that knows how to do it on a regular basis and does it correctly. We don't do crow's feet or any in the area as part of the headache paradigm. So that would not be affected because we don't inject that area.
How do I get more info about the tremor study you're doing?
You know what? I don't know. Heather, could you have a list of the attendees?
Yes.
Well, we can send you out or we can get your contact information and we can send one of our researchers to call you and tell you more about the trial that we're doing right now.
Great. How long will Botox work for excessive sweating?
So usually it lasts around 3 or 4 months, but some patients are really responsive. It can last up to 6 months. I don't see that often in my practice, but it depends on the dose you use also. Solidly it lasts for 3 months, and it reduces sweating usually by 80 to 100% during that time. It's not approved for the hands and the feet. It's a little trickier. It's a lot more difficult to inject, but in the armpits, it sounds like a terrible injection. Patients tolerate it really well, and it works really extremely well. Again, it has to be approved by the insurance, but it is the FDA approved treatment.
Could Botox possibly be used for shoulder pain due to biceps tendonitis, where the bicep muscle connects to the shoulder?
Sure. So we do use Botox, as I mentioned, off-label for any kind of tendonitis, even plantar fasciitis, which is a problem with the foot, off-label. And if there is spasms and tightness in the biceps tendon and it needs to be relaxed, which Botox does, it can be effective treatment. The problem is getting it covered by insurance. It's not a typical condition that most insurances would cover.
Great. That was our final question. Are there any more questions?
Yeah, if you have any follow-ups, if I didn't answer your question well enough, I'd be glad to answer. Just give you another minute, and if not, then we'll sign off.
Thank you very much, Dr. Taylor.
My pleasure. Hey, thank you very much for attending. I hope this seminar was helpful and informational.
Thank you.
All right.
Our next webinar will be held on Tuesday, September 5th. Dr. James Cassandra will be speaking about cubital tunnel syndrome. Enjoy the rest of your evening and good night.
All right. Thank you.
Thank you.